good evening, wherever you're watching us from. This is CACTV's live broadcast of yet another episode of PCEA Health Week 2024, all about facing alcoholism. The theme is coming back to senses, facing alcoholism. And tonight is all about alcoholism and mental health. What's your take on this? What do you understand about this? What do you have to say about it, even as we try to take forward this conversation of an adverse issue out there, mental health, but then how does alcohol make it even worse? My name is Vincent Kirosi. Taking this opportunity to invite your comments on our Facebook page, CACTV Kenya, our X account, CACTV_Kenya, 0211220044 is our SMS number. Drop your comments, drop your feedback. We'll be able to look at it and, of course, find our way forward, because at the end of the day, we must talk, but again, find a solution. On the show tonight, I have experts from all the way from PCEA Chogoria Hospital, where, of course, we are tonight to just help us understand this whole issue. And it's about time I invite them and welcome them officially on the show. To begin, on the far left is Stella. Stella, how are you?
I'm fine, thank you, Vincent. How about you?
I'm great. I'm great. Good to be here tonight.
Yeah.
Maybe help us understand where I mean, who you are, expertly who you are, and where you serve in the hospital.
Wow, thank you very much for the opportunity. My name is Stella Mwendwa. I'm a medical social worker at PCEA Chogoria Hospital.
Nice.
Yes.
My close left here is Roseanne. Roseanne, please introduce yourself.
Thank you very much, Finn.
Yes.
My name is Roseanne Jerry. I'm a psychiatry nurse. I deal with mental health related issues. Yes. Currently, I'm working in PCEA Chogoria Hospital.
Nice.
Yes.
And of course, looking at your t-shirts, I love them. Walk for Hope, breast cancer awareness. It seems you have an awareness movement about the same?
Yes, we are doing that.
Who help us understand that? Just shortly. I know it's not the topical issue today, but let's understand what this is all about, your t-shirts.
Okay. So maybe about our t-shirts for our viewers. Today we had an opportunity to launch and open officially our oncology units because from where we come from, our community, we found there is a huge need. Our patients go as far as Meru County, Embu County to receive the oncology services. And today we were privileged, even as we create awareness on breast cancer, we launched officially our oncology unit.
All right.
Yes.
Today is, of course, the recording day. Speaking about today, we are recording this show on Friday the 4th. So basically, when it be running, it should not be, of course, that day. But today on Friday, the recording day, they had a walk to just create awareness on breast cancer and also launch an oncology unit here at the hospital. So it's for you, the native and the local person right here, for you. Don't struggle again going forward, because now the unit is closer home. Now, today, we're having this talk on alcoholism and mental health. First of all, talk about alcoholism. Is it an issue here as compared to where I come from, Rose?
Yes. Alcoholism can affect anybody, any age, wherever you are. So even in this place, we have an issue, and mostly the highest number is 20 to 30, and that is that age they are productive, a productive age. So they are highly affected, because right now there are so many things that are affecting them mentally. So we can say that right now, everywhere in this nation, people, they are affected.
It is an issue.
Yes, it is an issue.
We must talk about it. How bad is it in your hospital when you look at it, you know, Stella, when people come to hospital, how are the cases of the adverse effects of AUD or alcohol use disorder, if I may call it?
Thank you very much. So the issue of alcoholism in our hospital and from within the locality where we work from is a huge thing that is happening right now. As my colleague has said, it's majorly affecting the young people, 20 to 30 years, and this has caused a lot of things, even from their community, some behaviors that are not very okay, and some also, but we have an opportunity here in hospital to work with them. That one we will explain as we continue what we do to them, and the groups that we have created here in hospital for them to have the opportunity to come and express themselves and for us to understand them.
Yeah.
Yes.
Lovely. Now, to bring this home, alcoholism and mental health. We know mental health is a real issue out there nowadays because of what is happening in the society, what people are going through, all the pressures of life and all that. This has made the cases of mental ill health to even go higher to adverse numbers than it was known before. Does alcoholism and, use of alcohol or abuse of it make it worse, make the mental health or ill health state worse?
Thank you very much, Finn. And I think it is important for us to know what is mental health. Some people, when you talk about mental health, they think about going mad. Mm-hmm. But I would like to emphasize on that.
Yes, please.
Mental health. When you talk about mental, you mean mind. Okay. And health is that well-being. Yes. So you need to be able to understand what it means with mental health. Mental health has three perspectives. Mm-hmm. For the first thing, you need to be psychologically well. What do I mean psychologically? I mean the flow of your thoughts. You need to make sure that you can be able to think the right way. You're able even to make a decision, because even making decision, it all starts from your brain. Right. So psychologically, you need to be fit. Mm-hmm. And then emotionally, how you express your emotions. Mm-hmm. When you're sad, how do you express your emotions? Mm-hmm. Then socially, how you relate with people. Okay. And then there is another one that we have added, mm-hmm. about spiritual. You need to be spiritually fit. Okay. And I want to thank the church, the PCA church, mm-hmm. because of what they are doing. Mm-hmm. Because this initiative that we've taken to come here, we are sensitizing people. Spiritually, they need also to be fit. So that is mental health. So we want to see how alcoholism affects your mental health. Yes. Another name for alcoholism it means addiction. Okay. Addiction or alcohol use disorder. Yes. So you will find some people, because the economy, it has a lot of up and downs. Yes. And some people, they will not be able to cope with these challenges. Some people, you will find they have depression, mm-hmm. and they don't know. Mm-hmm. They have some stressors, marital stressors that are stressing them. You find them going to alcohol to try to look for solutions. Mm-hmm. So you have a problem, you've gone to take alcohol, that day you will feel good, but the problem is still there. It means that the case, the condition will be worsened. So alcoholism, it will worsen the depression. It will worsen the things at home. Because, for example, if you had marital affairs and then you go and take alcohol, you will not be able to coordinate well at home. So the wife or the husband will be even more mad. So you will find you're making things worse. Mm-hmm. And, yes.
Yeah. So that means then that people take alcohol for different reasons. Yes. Some take because they want to feel good. Mm-hmm. Some take as a way of trying to hide from the reality, trying to take refuge in alcohol to just get away from their problems. So actually, people think that alcohol is a solution when it comes to issues to do with the mind, because itakufanya usahau kidogo ama ikufiche kabisa usione kile ambacho unapitia. But at the end of the day, you are not bringing a solution, Stella. You're making it worse. Yes. Really?
Yeah, very, very correct, Vincent. But sometimes we can look at this alcoholic issues, like maybe it's because the users are not educated, and I'm very happy today that we have come to sensitize. Some take alcoholism out of ignorance. They do not know the repercussions. They do not know that these alcoholism things will not take away my stressing, whatever. They will not take away my maybe
problems.
Yeah, any problems at home. And this is out of ignorance. So from our point, we cannot judge why they take alcohol. Is that we just understand it's out of ignorance. They do not know. But maybe from now, what this program that the church has started, it is going to give them more knowledge on how alcohol can bring them mental issues and mental disorders. But Vincent, from where we come from, we are very happy that the church around has even started something that they are calling Hope Church. And this is basically for alcohol addicts. They have accepted them now as we speak. There's a church from where we come from, Chogoria, just around. They have opened a 1-hour session for our alcohol addicts. They go there and fellowship, and they allow them to just go away. By this, they will just, the alcohol addicts feel like they are accepted, because that is one thing. They are accepted by these other members of the community who are not addicts. So this is a very nice initiative. And I think together we will be able to fight this alcoholism together.
I like that.
Yes.
I like that. Now then, help us understand, Rose, because you are a psychiatric nurse, you said, and we want to look at how then does alcoholism, or ile siku mtu amechukua kamnyweso, unaona, amepiga kachupa kake, how does it affect the brain to begin with, the coordination and everything? Tuanzie hapo.
Thank you very much, Vin. Yes. Ningetaka kuongea na Kiswahili ili tuelewe vizuri.
Yes.
The moment you've taken alcohol, a sip or a bottle, inaenda kwa brain. The first place inaenda kwa your brain. The first place ni kwa bloodstream. And the next organ itakuwa kwa brain. Then to the lungs, to the kidney, na inamalizia na the liver. So the moment you take that alcohol, alcohol has ethanol. Ethanol is a psychoactive substance. Psychoactive we mean psycho tumesema ni akili. Active ni that inafanya mind inakuwa active. For instance, there are some chemicals that are released in the brain. So the moment umekunywa ile alcohol, inafanya the brain to remove those, to excrete those chemicals. We call them neurotransmitters. For instance, we have a neurotransmitter called dopamine. Dopamine is a neurotransmitter that helps you to feel excited. So when you take alcohol, it makes your brain to be active. The ethanol makes your brain to be active, and you'll find yourself, you're very happy. Unasema pombe imenifanya nisikie mzuri. But in the real sense, these are a chemical that has been released. We have other chemicals that makes you to feel relaxed. Some neurotransmitters. So the moment you have maybe you have some tension because of, I don't know if you have ever seen this case, when there's someone I saw was going to get married and has social phobia, social issues, is afraid of being anaogopa tu watu. So that man took alcohol, at least ajaribu kukam kurelax. So it makes you feel relaxed. Then it sedates you. The brain says after imefanya brain ikakuwa all that active, imetoa those excited za excite neurotransmitters, it suppresses now your brain. It depresses your brain. Ndo sasa unasikia, hey, sasa nasikia tu kulala. That is why you'll find some people, they will use this alcohol when they don't feel to sleep. They are going to take alcohol. Ndo wapate usingizi. So when you take alcohol, that is what it does to your brain. Now your brain, mind you that your brain ndo inashughulikia kila kitu. Venye unatembea inaanza kwa brain. Venye unaongea ndo so your brain has been depressed.
The activity of the brain.
The activities of brain. That is why you will find someone has slurred speech. That is why you will find someone is staggering because the motor sensory, it has been affected. That is what it happens. It goes to your kidneys. We've said from the brain, now we go to the lungs. It affects your lungs. It goes to your kidney because it has to be excreted.
Yes.
You find some issues. Then it ends to the liver.
Yeah.
The liver, the work of the liver, it is to break down this alcohol. And the moment the alcohol is broken down, it is broken down to harmful substances. You see? So the moment you increase taking alcohol, that means your liver itafanya kazi mingi to break this alcohol, and the harmful substances bado ziko kwa your liver. And that is when you find someone the liver has been damaged. And most of them we've seen them in the hospitals with those issues.
It ends there.
Yes.
Ukiona mambo kama haya, Stella, you've said that people do this because possibly they don't understand, they don't have the information. If people knew the effect of what they are doing today in terms of taking in or abusing alcohol, then most of them could really decide not to. Do you then think that this information needs to go out more to people? And how then can this happen, especially to the locals? Manake watu wengine ambao huathirika sana ni those people that come from the lowly families and those that are not educated a lot, and not really to point out those that are illiterate, but this information needs to go even to the villages. Do you think that it needs to be done more needs to be done? Inaweza fikiaje watu wa kijijini kabisa?
So thank you very much for this question. I think it's very important for us to send this message to our villages and to our communities.
Kwa sababu mtu angejua kwamba hiki kitu nakunywa mwisho wa siku nitapoteza my kidney or my liver, and that means my life gone. Maybe mtu anaweza consider.
It's so unfortunate that before the church maybe was not very keen on this, because I feel like the church is the voice that should be heard from the community, because there is no community that we do not have access to any church. Doesn't really mean it has to be PCA, but any other church, because as she said, some of them feel they do not want to be associated with people, and that's why maybe they tend going to those places where they will get access to the alcohols. But the good news is, even the hospitals, like our hospital, PCH Ogoria Hospital, we've allowed these alcohol addicts, and not only alcohol, but other drug and substance users, we've allowed and opened our gates to them for free. We have a group we call Recovery Group, where we gather the alcohol addicts and other substance users. They come together because now they have a common addiction. They come together and share. They share their struggles. We listen to them and understand where they come from and how they found themselves here, and it is free of charge. So that one, we can say we've eased the costs, maybe because some of them they feel the treatment could be very expensive. So there is an opportunity for the church hospital, like this hospital, Chogoria. It is free of charge. We begin from the recovery group, where we encourage even the relatives to come in during the sessions for the addicts to feel supported, because they need to be supported, because recovery is a process, and you need a treatment supporter, because sometimes you may feel discouraged and the peer pressure around you want to invite you back, And after now recovery group, we even have a clinic we call Tumaini. Tumaini means hope. They need to feel hope because some of them have diverted to alcoholism due to lack of hope. They feel hopeless because of some things that maybe have happened in their lives, and we have that opportunity to have a Tumaini clinic. So for Tumaini clinic, an individual can come out of the recovery group because some of the clients we see here, maybe they could not be free to share every detail in the group. We give them now an opportunity to have an one-on-one with the doctor. And the doctor doesn't even work alone. We have a psychologist also. As we said, mental health has three perspectives, as she said, I won't repeat. So for the psychological aspect, we have an expert who is a psychologist. And now after psychologist and the doctor in the Tumaini clinic see them, there is also a higher referral. We are privileged to have a psychiatrist. A psychiatrist now is the highest level of a doctor who deals with mental health. And in our facility, we have that doctor who is available.
Okay.
And if our doctor feels this client needs more treatment,
Then
they will
do a
then be
referral.
referred there.
Yeah.
So there is an opportunity, and the message, I think, can be spread to our communities.
I love it because the hospital is equipped and ready and trying to, as much as possible, to bring these people help that they need. Now, let's talk about depression. Depression is an issue, big time. And unfortunately, it has gone to a level that we've lost people out of this, whether through lack of understanding or lack of help. How does alcohol, relate with this? Some people, we know that some people think taking alcohol could, sometimes alleviate what we are, the mawazo yenye tunapitia and what we are thinking, the kind of bombardment we have in our heads. And some also do this by taking alcohol and trying to kind of postpone what they should address, and then it gets worse. So how does alcohol make depression even worse in society?
Thank you, Vin. I would like to lay the basis first of alcoholism. The first thing that we need to know, it's a disease. Alcoholism is a disease.
That is actually why it's called alcohol
use
disorder.
Yes. This was it was said it's a disease in 1956 by American Medical Association. It is a condition whereby a person is unable to control his drinking habit or even to regulate. So in case apata mahali kuna penywa na pombe atapenya. Anapita nayo. Irrespective of, we should not forget, irrespective of the harmful effect it has. Whether anaumwa na tumbo, atajipata hawezi control, anakunywa. Atakunywa tu. So ukijua ni ugonjwa ambao ina affect your brain. That is very important. And also to understand what is depression is also necessary.
Yeah.
So that ujue zote mbili how they relate. So depression is a condition that affects your brain. And it has some characteristics. Mtu akipata stress kumbira anasema mimi niko na depression. I want to make it clear today that depression, it has some characteristics. And these characteristics, they must occur at least 2 weeks every day.
Okay.
2 weeks every day.
Okay.
I'm going to list some few of them so that ujue kama ni depression ni nini. So persistent sadness. If this sadness persists for at least 2 weeks consistently every day, and this characteristic you must have at least 4, 5, 6. So a person who has depression has persistent sadness. Another thing, feeling of guilt. You see,
Ajihukumu sana.
Anajihukumu, ajui ni nini, but anajipata anajihukumu. Lack of concentration. You can not concentrate either in your work. When you start this, umeanza ingine.
Unaachia kwa njia. So you are doing 5 things, but nothing is going to completion.
Yes. There are some people who will have suicidal thoughts. Suicidal thoughts. They feel they are not worth living. There are others who will lack sleep. Na hapo ndio pombe inakujia. There are others who will have we have lack of appetite. And there are some, it is also important to know there are some people who will be stressed and eat a lot.
Binge eating.
They will eat a lot, and mostly they eat sugary things, junk food, mandazi, those things. So if these symptoms, even there is loss of hope, at least if you have 4 or 5, you need to understand that something is going wrong. You are setting into depression, and you need treatment for depression. And treatment goes to up to even 1 year. So ukianza dawa January, unaenda 6 months, you come back for review. Daktari anajaribu kukuongeza dawa for at least a year. So that is the seriousness of depression. So ukistressiwa siku 2, ukose usingizi siku 1, that is not depression. You need further review. So alcoholism, you will find someone has all these conditions, these symptoms like lack of sleep. They have issues with their family. So this person feels, I cannot sleep. And these things are beyond me. So what do I do? Let me go and take that alcohol, nilale. But the problem is still there. And that is why when you come to the hospital, the first thing we do, we don't rush to treat alcoholism. We take the history, comprehensive history. What made you to start alcoholism? Anasema bibi alinisumbua, watoto sina fee, all those things. So you will start to manage depression first. You try, and that is why we combine medication. There is medication for depression. And when you see that after you take medication, you're stable enough, we can connect you to the psychologist. So psychologists will assist you on coping mechanism. How can you cope with these stresses? When things happen, how can you cope? So you're going to have talking sessions. And then from there, alcoholism now we can manage, because the first thing, we have dealt with the core problem. So the moment you go to take alcohol, you worsen the condition. The anxiety, for example, when you're anxious, maybe some people take alcohol. For instance, someone who has been abused. You know, that thing has a lot of trauma. You will find these people, they might want to take alcohol, kujaribu kusahau what happened. But we've not solved the problem. That is why if there is someone who is undergoing maybe anxious of anything and you're not able to control, come for medical checkup. Maybe you can have a talk with a counselor and you try to solve these things. Because alcohol will not solve issues. It's adding a problem to another problem.
Yeah.
Thank you.
Yes. Still in the hospital, how is the hospital handling such cases of depression?
Yes, so before answering that, there is a question you had asked about reaching the message to the community. And as the hospital, we have a team for the mental health that consists of a doctor, a nurse herself, myself, a social worker. We have a chaplain team, and we have psychologists.
Okay.
So for this team, we have organized ourselves on how we'll be spreading the news to the community. Like maybe twice a month, we go out to the churches. We assign ourselves, you and you go to this church, you and you go to this church. Like the next week, we will be going to 2 churches, and that one we are able now to take the message to the community, because we believe church as a very big congregation that they could be having relatives and children and also friends who are addicted. So that one, the hospital has taken the responsibility on that. Yes. And the way now we deal with alcoholism with the hospital. Yeah. So as I said, we have the addiction group that we call the recovery group. So this is where we start. When we come across an alcohol addict, it doesn't necessarily has to be in the outpatient. Even the ones that are inpatient, and we realize after taking long histories that this patient could be suffering maybe from alcoholism, or even right from the outpatient. If we note them and we sensitize to them and we approach them in a kind way, they accept, and we accept them in, and we talk to them, and with the support of maybe the family members, we are able now to walk a journey, because it's not a one-day journey. There are some patients who have been to the group for like an year now, others more and others lesser, and we are still continuing to do therapies with them. And we also want to urge the community to accept them back, because some of them have lost hope on their relatives completely because they are alcoholic. Now, as the hospital, we are also encouraging the relatives. As a social worker, I have seen patients in the ward who even relatives do not want to come to visit them. They do not want even to be associated to them.
Yes. Even as you say about, I also want you to include and tag along what you're saying with stigmatization.
Yes.
These guys feel like, okay, we are not accepted. We are rags. We are filth in society. Stigmatization also, even as you continue to say.
Stigmatization is very big, and actually stigma even is not coming from people who are very far from the addicts. It's coming from their houses, from their parents, from their brothers. And maybe if a parent has 2 sons and one is not addicted, they want to associate with the one that is not addicted. And when the moderator of PCA, the 24th moderator, was launching the health week for the PCA, he talked about the prodigal son, and he talked it very powerfully. And also from our side, we would urge the community and the family members to accept this prodigal son who has come to realize their mistakes and themselves through the help of the healthcare workers that we work together. Because even them, maybe they were pushed by something. They were pushed by something to go and get themselves into alcoholism. So we want to urge the family members to accept, because once they feel accepted, then they'll be free to come back. But you'll find most of them will go to alcohol because they feel their friends are better than their family. Washafanya marafiki kule nje. Wale marafiki wanawakubali. And you will be surprised, these alcohol addicts are very friendly. They are very friendly.
They're nice people.
And they love each other. And they want to run where they are loved. So let us love alcohol addicts. They are our own. Yes.
Yeah.
Yes.
Love that. Now, let's look at alcoholism and self-harm and suicide, because people tend to say enough is enough. Wengine wanajidunga just to feel. I was talking to a friend some time ago, and she told me that when things are thick, she finds solace in alcohol first, alafu she go pricking herself with sindano, anajikatakata kwa wembe, and she just feels like now she's kind of feeling better and solving the problems. So alcoholism leading to self-harm and suicide, and people just deciding to take their own lives.
Thank you, Vin. As we've said before, that now you're out of control. Human being has willpower. And that willpower inside you is what makes you make decision. This is right, this is wrong. I can go this way, I cannot go this way. So when alcohol comes in your life, it takes your power will. You cannot make a decision for yourself. And at times, maybe a man in a family, you're not able, if you're not able to take care of your responsibility, you'll find even these people, the family members, they don't recognize you. They don't recognize your presence. And this might make you feel helpless. So the first thing the alcohol does, it makes you feel you're nothing. And even before we go to the process of recovery is a journey. And we usually tells people it starts with acceptance. You accept, yes, I can't. So some people, they don't know that the alcohol has taken power. That is why you'll find the things that they used to do when they were okay. Mtu anapata siwezi fanya, hata hiyo kazi siwezi sustain. And they feel helpless. Then what my colleague has said, then stigma comes in, maybe from the family, because you'll find some of them, they even take loan so that they can take care of the alcohol. They want to because alcohol, you cannot control the amount you're taking. They will even take loans. Some of them, they are going to be sent away from job. You see, they become totally helpless. And when you're helpless, what is the point of living? That is why you will find some of them, they are committing suicide because they feel they are helpless. And that is why we are talking about sensitizing people. We ourselves, we start sensitizing our colleague. We sensitize our colleagues, the community, so that you can identify alcoholism. How can I identify someone who has alcoholism? It is by this and this and this. You try and help that person mapema before afike mahali ya kujiua. So it is important to sensitize people. Yes, and that is what we are doing here in Chogoria. That is why we are going to the community's chief barazas. As we've heard, we have this recovery group where where we have those people who have been addicted. They come together. The journey to recovery is not easy. That is why you find people are coming. Leo unasema nataka kuacha, you find yourself you're coming back. But when you have a team of people who can assist you, bro, ni sawa, you can still make it. You know, they feel better. We incorporate even the family. So ukikuwa hapo kama family member, and hata kama ulikuwa umeluso because of your child or your husband, na usikie there is someone else ako hapa na alipona, you just feel encouraged and you try to help this person, you see? That is why we have mental health psychiatrist is coming every month. We have psychologists is there Monday to Friday. We have psychiatry nurses there Monday to Friday. So that every day is covered. In case you need assistance, we are there.
You are available.
Yes.
You wanted to chip in, Stella?
Yeah. So apart from intentional suicidal attempts, we also have RTAs, that is road traffic accidents that happen, and we receive many border riders who come in with accidents, with so much fractures, and when we receive them from casualty, they are intoxicated, and this is a huge effect from alcohol. And now this is why now we want to sensitize people. And now after they have brought into the hospital and they have these fractures, this means they will have to stay in the hospital for a couple of days for treatment. And these young men, they have families, and this now means that the families have been neglected for some time. And apart from that, there is also financial straining because the bills have to be settled and all that. So apart from the intentional suicidal attempts, we also receive so many casualties that is a result of alcohol abuse. Yes.
Now, even as we get to the tail end of this conversation, now I want us to look at the way forward. And I like us to look at it from this point. Roseanne, you help us to understand, talk to that one person out there who is struggling with this disease, because alcoholism is surely a disease. This one person watching this program and they are struggling, they don't know the way out. Please try to help them. Try to direct them the way out. And then after that, Stella, you talk to that one person who's watching as a support system to these people, as a family, as a friend, as a colleague of a person struggling with this condition. How do they help out? And what are the options out there that are available for these people? Yes, please. To begin with, Rose.
Thank you for this. Alcoholism has a lot. We cannot cover it within a day.
Yes, you wanted to add something?
We will come. But I would like to encourage someone who has, who feels that now things are bad. They don't know what to do. There is help. And we do say that it is okay not to be okay. So if you feel that you are at your lowest point, people, that is why people are here. We as the medical practitioners, the community, we are there to support you. It is possible to recover. Just believe it. Just change your mind towards it. And it is going to be well. Thank you.
All right. Thank you very much. What about you, Stella? To these people who are around our fellows who are struggling with alcoholism.
Okay. So what I can tell our treatment supporters for our alcohol addicts is that do not lose hope. This is a journey, and it is not a journey for yourself alone. We are also here. We want to hold your hands. We know at times it might become tough on you, but just hold on that person. Hold on that brother, that sister, that colleague of yours who is addicted. I'll just give a story of a young man from where I come from my village. He was an alcohol addict. Like everybody knew. It's like he was tagged the #1 addict, the #1 user of alcohol. And he used to be seen everywhere. Even the chiefs had already known he is the guy behind alcohol in the community. And church participated hugely on his recovery. So he just came to contact with the pastor through the assistance of the spouse, and this spouse had tried all means even to take the guy to the hospital, attempts failing and all that. And once they contacted the church was able to hold him hand, and right now is like the most responsible man in that community. Every other group wants to call him chairman because here is very good. He's good in reasoning. And I want to encourage people, do not look down on these alcohol people. They could be your future bosses. They could be your future pastors, your future colleagues. So if this one man I have seen with my eyes could change and become the guy I know is very, very instrumental in the community right now, also you and your family can recover. So let us not lose hope on them. It is very easy, by the way, to lose hope on alcohol addicts, but my encouragement to our viewers is that don't lose hope. Hold on. If you feel like you are tired and you need help, we are here. PCH Ogoria Hospital has given you an opportunity. Just come in and we walk this journey together. So thank you very much. And
you said most of these services are not costly. They are free, most of them.
Yes. Yeah. The recovery group is free. The psychiatrists and psychologists are at a cost, but it is affordable. Yeah. But the recovery group is absolutely free, and this is where we begin. Just come in and express yourself.
The doors are open.
The doors are open.
Bila shaka.
Yes.
You want to say anything even as we close?
1 minute.
Yes.
And sensitization, those health talks we are doing for free. Apart from hakuna kitu tunalipisha, hata ukituita wapi, the hospital is providing for transport, so we'll do it for free, so we are ready. Yes.
Thank you very much. It's good that this information gets out there for the locals to understand that help is available. Help is not as far as you people think it is. It's not as costly as you think it is. It's actually very affordable, very available, and sometimes very free. So just open up, come, and help is there for you. So long as you want it, you'll get it. And I don't want to add anything on top of that. Thank you, my sisters, for this wonderful show that we've had, the information that we've given out there, the help that we've tried to give to our viewer. I believe that is going to go a long way in helping the society deal with alcoholism, because it's a major issue right now. And until we speak about it, then we're not going to get a change. So it is just in handy, this topic and theme of the PCA Health Week 2024, all about getting back to your senses and facing alcoholism for that matter. It is important that we speak about it, because that way we are going to change and transform our society. Continue watching CAC TV, because we have a series of these and more shows on all about alcoholism, and I believe that at the end of it all, this is going to become better. My name is Vincent Keros. I want to say thank you for watching us this night. Thank you for talking to us on our SMS number 0311 220044, on our socials, Facebook CAC TV Kenya, and on X CAC TV_Kenya. Let's keep the conversation going, and let's see how far it goes. My name is Vincent Kerosi, saying good night. Ciao. Kwaheri.